Hello, I recommend that you watch the first part of this presentation before you see this one. Alright, let's talk about high BP. Make sure that you get your blood pressure checked at least once every 6 months. And if you already have a diagnosis of high BP, you may want to get it checked more often. If you have this diagnosis, make sure that it is under control, and control means that your blood pressure is less than 130/80. Take medicines as prescribed by your doctor. Remember that there are always equally effective generic alternatives available for most brand name expensive medications. You may want to ask your doctor about them. And try and reduce your salt intake. Easiest way to do it would be to avoid pickles, avoid soft drinks, avoid evening snacks, which all of these tend to have high sodium content. Just so you know, our daily salt intake is supposed to be less than 1 teaspoon, which is less than 5 grams of salt. And if we take this as the standard, then majority of us are eating way more salt than we should. One simple way to reduce your salt intake is basically try using less salt while cooking food, and over time I think your salt intake will definitely go down. High cholesterol is of course a risk factor for heart disease. The most important thing to remember is that unless you get tested, there is no way to know. So get tested first. And the test is fasting lipid profile test, as we all know by now. And in your report, you need to check for the following. Is your total cholesterol less than 200? Is your LDL cholesterol less than 100? Is your HDL cholesterol more than 40? Are your triglycerides less than 150? If they are not, your goal will be to bring them to this level. And I've discussed this in detail in the topic cholesterol. Type 2 diabetes is another very important risk factor for heart disease. And if you have diabetes, it's very important that you keep it under good control. And what good control means is something that we've talked about in the topic type 2 diabetes. Your hemoglobin A1C will need to be less than 7%, and you will need to get it checked every 3 to 6 months. Also, there is a test called urine microalbumin test. You will need to get it done once a year and make sure that it is normal. If not, your physician will recommend the steps that you will need to take to bring that level under control. And this will involve, in many cases, taking medicines. Now, if you do not have diabetes, it is still important that you get tested periodically for it. I would say at least once a year. And if you have pre-diabetes, and what pre-diabetes is, we've talked about in the presentation by the same name. You will need to get tested more often if you have this condition. Normal is if the fasting blood glucose is less than 100 milligrams per deciliter. If you have diabetes related eye, kidney or circulation problems, your risk for heart disease is a lot higher than someone who doesn't have these conditions. So also it indicates that your diabetes is probably not well controlled, and it's extremely important that steps are taken by you and your physician to help get your diabetes back under control. Did you get these basic tests done yet? Fasting lipid profile test, fasting glucose, and hemoglobin A1C. And I've gone over some important basic stuff that we all need to keep track of in the topic Know Your Numbers. If you have high BP, diabetes or certain other medical problems, your physician will more than likely recommend a baseline ECG, also a stress test if needed. The typical Indian male lipid profile pattern, just so you know, is high triglycerides, low HDL cholesterol and moderate to high LDL cholesterol, an extremely bad combination. if this exists in addition to high BP or diabetes, you can imagine the risk for heart disease would be, of course, a lot higher. A brief word on the role of medicines. They are absolutely necessary if you have multiple risk factors or certain medical conditions. Understand the purpose of each medicine being prescribed. And for every costly medicine, remember that there are cheaper, equally effective, brand name or generic alternatives, and find out from your physician if they are suitable for you. It's important that you inquire about any serious side effects with these medications, and most importantly, find a good physician who will listen to you. If someone were to have symptoms from heart disease, how does it feel? The most important symptom is angina, or chest pain or tightness in the chest. That comes on with exertion and relieved by resting. Then again, symptoms may occur even at rest, last for a few minutes and then go away. You can also have pain in the jaw, the arms, both arms, or one or the other side. You can also have pain in the neck, and these symptoms may occur with exertion or at rest. It's another form of angina. Shortness of breath can also be a symptom, and again, this can occur with activity or be present at rest. Excess fatigue with activity, and palpitations with activity or at rest. These are, I would say, some of the main symptoms of heart disease. Now, when someone has a heart attack, what symptoms may they have? Heart attack for most people is a crushing or a stabbing sensation in the middle of the chest or on the left side. It can also be like a pressure, like a heavy weight sitting on the chest, or a squeezing sensation, and sometimes a burning sensation. Now, this pain can also occur in the jaw, or in the arms on either side, or in the shoulders. Keep in mind that chest pain can sometimes be accompanied by these symptoms, and then again, you may just have jaw pain or left or right arm pain without having any chest pain also. And pain in the upper stomach can be a symptom of a heart attack. Shortness of breath, sudden onset of shortness of breath associated with profuse sweating, and symptoms lasting more than a few minutes. If the symptoms have gone on for at least 2, 3, 4 minutes, then certainly it's important that you alert your family and take action immediately. So what are the immediate steps? If you think you or a family member is having a heart attack, the most important thing you will need to do is to call the ambulance service. 108 comes to mind, available in many areas across the country. If for some reason you are unable to access ambulance service, you will need to rush to the emergency department of the nearest well-equipped hospital immediately. Now, if you have access to aspirin, it would help if you chewed, not swallowed, but chewed one whole aspirin, an aspirin 325 milligram tablet immediately. And keep in mind that if you've had an allergic reaction to aspirin in the past, obviously you should not follow this step. And if you have a history of heart disease, your doctor may have given you advice on what to do in case of such a situation. So follow your doctor's advice and take any specific medicines that have been prescribed by your physician for these types of emergencies. Now, most important thing to remember is that time is of essence. Do not delay. You will need to go to the hospital immediately and let the doctors there evaluate you and take action right away to help control the damage to the heart muscle. Thanks for listening.